Hello and welcome. I'm Andrea Sanke. How do we solve the most pressing challenges facing girls and women today? Well, that's the agenda at the Women Deliver 2016 conference here in Copenhagen. Joining me in the studio now, I have with me two people who are working to ensure that women and girls all over the world have access to strong primary health care. First, Suzanne Ehlers, the CEO of PAI, who has been working for women's health rights and empowerment for the past 15 years now. And here immediately to my right, Atul Gawande, medical practitioner and Harvard professor, as well as executive director of Ariadne Labs. Thanks both so much for joining us.
Thanks for having us.
I'll start with Atul here. Just tell us exactly what strong primary healthcare systems actually entail.
I think that the bottom line comes down to what we call the 4 C's. Do you have, in the course of your life, a regular place that's your point of contact for any of your medical needs? Continuity, they know who you are over time. If you have high blood pressure, they can follow it over time. If you have diabetes, they can follow it over time. TB. Do they have coordination? If you come for prenatal care and you have risks, do they communicate with the hospital ahead of you and coordinate? And comprehensiveness. Do they handle not just a few things in your life, but the ability to do prevention, to do acute illness and chronic illness management? That's what a primary healthcare system is, that it all takes place outside of a hospital.
Where are you seeing these systems? Who's providing the models?
Well, in one way, almost everywhere has these crop up because people have these needs across the course of their lives. Sometimes it's informal practitioners, sometimes it's private sector, sometimes it's public sector. The issue is it doesn't work very well. And we see pockets where it works reasonably well, but it actually is a problem whether it's high income, low income, middle income. Assuring people have good regular sources of care across the course of their lives. We've seen, some amazing places in Costa Rica or isolated examples in individual parts of India, sub-Saharan Africa, but it's not the regular experience for most folks.
Suzanne, where are you seeing the most need for this kind of attention?
Well, I think the work of PAI is focused on the needs of women and girls. And so for me, I see that the primary healthcare systems, when it's weak, it really disproportionately impacts negatively the lives of women and girls. I mean, we know that upwards of 75% of maternal and newborn child deaths could be averted through the provision of care at the primary healthcare level. And we're just not getting it right. We're not bringing those services together in a way that's accessible and convenient for women. So that's everything from your family planning services to find your birth control. It's where your children get their immunizations. It's where you go when that child has a fever and you want to know what the problem is. It's integrated in a way that can solve so many of women's health needs with their families. And when we see that system weak, we see women suffer disproportionately.
You do see women suffer, and it particularly impacts women's rights and equality.
That's
How
right.
so?
Well, I mean, it's already, we're looking at sort of getting at gender bias in the system writ large, and so we know that gender bias exists also within the primary healthcare systems. We also are looking at ways that we can reduce stigma for women. So if you have a system where they can seek a whole variety of services, they don't have to travel miles to find family planning in a secret place so no one in their village knows. They go to a comprehensive primary healthcare center right in the center of their town, accessible, convenient, and it's no one's business what sort of services they're seeking there. So it's also a way of reducing stigma and the fear that women have in seeking some of the services that are most central to their lives and their health.
Go ahead.
Well, I'll give you a concrete example. So my family's from a rural village in India, and my father watched his mother, my grandmother, die from malaria at a time when there was known treatment. He was 10 years old. She went to a government center, and they didn't have any treatment that they could offer. So he's watching her die over the course of 6 weeks. They go to a private practitioner. The private practitioner teaches him, it's a non-medical person, teaching him how to feel the pulse so he could know if something was wrong that he needed to bring her back. To this day, he feels as if he was responsible for her death because he couldn't feel her pulse right when that had nothing to do with anything. It was a system where she could not count on having basic health needs as part of her care, and that's that basic right that we're talking about.
Right. So you've identified the problems. You know what's needed and where. Mm-hmm. So what are your next steps? How do you actually change what's on the ground?
Shall I jump in? Or?
Go ahead first, please.
Well, what we know now about solving systems is that the first thing is to define what the minimum expectation is. And the expectation are the 4 Cs, that you have a point of contact access, that you have continuity, you have coordination, and a comprehensive range of services. Then the next thing is to measure the gap. Well, how big is the gap between what is there and what isn't there, and make that public and make that transparent to the leaders who need to then build an agenda around it. Right now, the weakness of the primary care system is invisible to most of the world, and so the first step that we think is necessary is making the invisible visible with data.
With data.
Right. And I absolutely agree with the data point, and I also think in addition to those 4 Cs, I'm going to add an A, which is advocacy. So we know that primary health care, it's not only undervalued, it's under-resourced, it's misunderstood. I think there's so many advocates around the world who are working on family planning or working on malaria or care about tuberculosis. We all need to dedicate some percentage of our advocacy energy to saying our verticals can't be strong unless we have a really strong foundation, and that foundation is primary health care. So we've got to get advocates to better understand how the centrality of this system really determines the strength of our individual movements, that we are the sum is greater than the whole of a part, or however you say that.
Right. And there really is a coordination effort needed here too.
Coordination.
But is there something individuals can do to take it upon themselves to further this cause?
Well, it's hard when you're an individual. The biggest thing, I think, comes from being able to simply advocate for and speak for the concept of primary health care, that it is a right to have a system that can take care of the majority of your needs, and to expect it can do more than just provide a vaccination or take care of a modest range of things. Now, people are naturally seeking those out, and they seek into the private sector and the public sector, but I think they can expect that whether it's private sector or public sector, it's held accountable for whether it's providing that care.
Suzanne?
I think also from an individual level, I think we need to remember that primary health care is important not just in moments of crisis. I think that's when your individual is sort of alerted to this issue. They see Zika, they see Ebola, and they understand then that a weak primary health care system can't deliver needs within that crisis environment. But even during times of relative calm, we need a strong primary health care system. And in fact, if we did the effort and put in the resources in those moments of relative calm to really build the primary foundation, if you will, then during crisis we would have a stronger system on which to rely. And so for me, it's the individual understanding that this is something we've got to put the investments in and really build throughout.
And we have seen that, by the way, whether it was talking to the minister in Afghanistan, where she's been able to go from less than 9% of the population having a primary care physician within an hour to about 30%. You know, it's not 100% yet,
extraordinary
but she's
growth.
able to make absolute growth in a war environment. Then you see places like Costa Rica, where they've been able to take on even bigger problems, saying that, you know, we want to make sure that all women have access to contraceptive care, that their kids get all their vaccines, and that while they're recognizing that, they've been able to now pick up on when they have high blood pressure and make sure that's under treatment. There are places that when they focus on making primary care a priority, they're able to advance the ball.
Right. And it is fair to say that women and girls pay a disproportionately high price when the primary care system is weak.
Right, and then they also have incredible gains and incredible successes when the primary healthcare system is strong. You know, so if we're really able to focus on what the strength of that system can bring to a woman who oftentimes have limited mobility, limited accessibility, limited resources, limited time, quite frankly, and energy to seek out services, let's not send them to sort of separate clinics over the course of a week. Let's send them to one place, one day, where they can have a whole multiplicity of their health needs met and addressed in a place where they trust they're going to be well diagnosed and well cared for. I think it's really going to be the key to the long-term empowerment of women and girls.
Okay. Suzanne and Atul, I'm going to let you have the last word, Suzanne, because unfortunately we're out of time. I'd like to thank you both so much for joining us. And thank you for joining us for this Women Deliver program. We hope you'll join us for many more. Remember, you can tweet your comments and questions about this and our other shows using the hashtag WDLive.